So I'm going to be presenting on preoperative and postoperative care of the open heart surgery client. And if y'all would just follow along with your handout, that way we can be on the same page. So what exactly is open heart surgery? So open heart surgery refers to any operation that is performed on the heart when it is put on the heart-lung machine. And how do we actually perform this? So an incision is done. It's often smaller than the actual breastbone because skin can be stretched. And then a sternotomy is performed. So that means the breastbone is broken essentially and cut away from the body. It's later put back with wires. And then they remove the thymus gland, which is necessary to see the heart. And then lastly, to expose the heart, you cut the pericardial sac is opened. So how exactly is all of this accomplished on a beating, bleeding heart? So the heart-lung bypass machine is crucial to this. It functions as the heart for the body while the heart is being operated on. So what it does is it continues to give our bodies the oxygenated blood that it needs to the body so that the heart can be operated on and not be functioning as that, like I said. So it's done by giving the heart a solution called cardioplegia, which is a cold, high potassium solution that essentially stops the heart from beating, but it also protects the muscle while it's being operated on. So some fun facts about the surgery and how it's done is that we often experience pain because the nerve endings in our tissues, and in children and infants there aren't a lot of tissues and muscle mass at the chest wall, so essentially not a lot of nerve endings to send pain signals. So after the surgery, often infants and children are sent home on just Tylenol or ibuprofen because the pain isn't really that great. Also, 22,000 pediatric heart surgeries are performed a year in the United States, roughly. So what do we need to look for before the surgery occurs? So when it comes to clinical manifestations for open heart surgery, there aren't necessarily a lot of go-tos because it's often probably a long trail leading up to having open heart surgery. I'm sure procedures and other options are definitely tried first before open heart surgery is the option, although sometimes it's the only option for certain heart defects or things of that matter. So a patient's medical history is going to be looked at, their physical assessment is going to be done, and everything is going to be reviewed as a whole before surgery is indicated, but then if so, surgery will be scheduled. So intraoperatively, you're going to look at complications like, you're going to look out for things like inadequate organ or tissue perfusion, activation of a systemic inflammatory response, or embolization of air or blood. Blood clots are also going to probably be a risk and complication we need to look out for post-operatively as well. So like I said, post-op complications we're going to be looking for are things like the blood clot. We're also going to be looking for possible infection occurring. So you're going to look signs for fever, redness, heat, pain, tenderness at the surgical site, more than would be expected. And you're also going to look at changes of drainage that are coming from the surgical wound. Interventions kind of go along with these clinical manifestations, and what you're going to be doing intervention wise is infection control, turn your patient every 2 hours, cough, deep breathe, just kind of like you would with any other surgery. You're going to assess chest tube patency and the drainage that's coming from it, assess pupil response and level of consciousness, administer pain medications routinely and PRN, evaluate effectiveness of pain medications after you've given them, administer O2, auscultate the breath sounds, monitor weight before and after surgery because we know weight, if a patient is gaining a lot of weight, it's often indications of congestive heart failure. Monitor the ventilation settings and assess for the surgical incision. So all of that is going to go into the actual nursing care. Our nursing care are our interventions. So before surgery, we're assessing things like vital sign, heart rhythm, skin color, your pulses, cap refill. You're going to monitor for tachycardia, tachypnea, crackles, frothy secretions, a decreased urine output, fluid status, and pulmonary edema. Pulmonary edema is a big one because infants are at risk for the congestive heart failure. So again, the weighing is important. After surgery, we're going to be looking at assessment of vital signs, pulse ox, skin color, cap refill, and distal pulses again. The PICU is where the child is going to be placed, probably for a few days. We're going to monitor labs like INO, cardiac function, respiratory function, drainage, and again, pain is huge. But again, they shouldn't be experiencing too much of that. We're going to note any signs of respiratory distress, and we're going to indicate development of a pneumothorax or the cardiac heart failure, and offer a lot of family support, because having a kid in the hospital and experiencing such this is an intense surgery. We're going to need to be offering a lot of family support, comfort, talking them through it. Education is going to be key. So with that, we're going to talk about the NCLEX question example on the handout. So I'll read it, we'll read through the answers, and then I'll go over which one is the correct answer and why. So after open heart surgery, a client developed a temperature of 102 degrees Fahrenheit. The nurse notifies the physician because elevated temperatures, A, increase the cardiac output, B, may indicate cerebral edema, C, may be a forerunner of hemorrhage, or D, are related to diaphoresis and possible chilling. So the answer is A, because when a temperature gets to 102 or greater, it's going to cause an increased cardiac workload. And after our patient has just had open heart surgery, this is indicating a lot of danger signs. So we're going to notify the physician of A. Okay, lastly, we're going to just talk about the nursing diagnoses that are kind of accompany the pre-op and post-operative open heart surgery of a pediatric client. So nursing diagnoses include acute pain related to surgery, decreased cardiac output, risk for infection, risk for bleeding, caregiver role strain, activity intolerance, delayed growth and development, impaired skin integrity, risk for injury, impaired spontaneous ventilation, and interrupted family process. So if y'all have any questions, feel free to email me, but I hope that you got a good grip of what pre-op and post-operative open heart surgery entails for our pediatric patients. So my email, if you need to email me, is egc1036@uncw.edu. Bye, guys.